Bleeding in pregnancy is something that you should always talk to your doctor about, and as concerning as it can be, it's not always as severe a situation. First trimester bleeding is really, really common, and it's always important to call your doctor for first trimester bleeding. If you haven't yet had an ultrasound, then that'll be the first thing that your doctor is going to do. We need to make sure that the pregnancy is in the right place in the uterus and not in the tubes like an ectopic pregnancy. If you've already had an ultrasound and you're bleeding, then we know it's not an ectopic pregnancy, but we need to make sure that the bleeding hasn't affected the pregnancy. And if the bleeding doesn't persist out of the first trimester, then chances are it's not going to affect the rest of the pregnancy. In the second trimester, any bleeding, brown, red blood, spotting, heavy, you really do need to call us. Different causes behind that bleeding can be placental problems. There can be placenta previa. There can be preterm labor. Closer to full term, there can be something called placental abruption, and all of these can be potentially serious. Patients get closer to full term and they're starting to go into labor. It's not uncommon to have a little spotting as the cervix is softening and priming for labor. So sometimes that'll be the first sign of labor beginning and is nothing to worry about. Plenty of patients call with bleeding, and this isn't always a doom and gloom situation, but the important thing is to come in for the appropriate testing and to make sure that everything's fine at that point in time.